Hello, my name is Richard and I'm 62 years old, and I was diagnosed with advanced prostate cancer about 18 months ago. So I've been on various drugs, as those of you who have it will understand, including Prostap every 3 months. Now it just so happens that I'm working abroad and the 3-month interval happens to occur now. So before I left home, I persuaded my local doctor's surgery to let me take the injection away with me and perform it myself. Now, I've never injected myself before and I'm a bit nervous. And so I thought I'd record it because there may be other people out there who are also nervous and may also have to inject themselves. So let's go through this together. Now, I'm not per se afraid of needles. All my adult life until I got cancer, I used to give blood specifically to try and inure myself from the fear of needles. But I've always turned away when the clinician, whoever they are, has put the needle in. I can't wash my hands because I'm on a boat and all the water is turned off. But although I washed my hands earlier at the hotel, I'm just going to use some wet wipes to clean myself a bit more. Right, so this is the injection, and those of you who may be more curious than I may have seen already what it consists of. So it's this 2-function syringe. And it's, importantly, I've had it for a month. It doesn't need to be refrigerated. In fact, they say it shouldn't be refrigerated. But it has 2 separate parts to it. There's a fluid there, and there's a powder inside a sort of double-ended plunger. Now, I'm told what you have to do. Why did I never watch? Anyway, there's the needle. And I believe, oh yes, we have to screw in the external plunger. Like so. And I'm just going to put my most attractive glasses on. And then push up until the powder inside the middle chamber. Oh, see, so it's actually that's not a double-ended plunger, that's 2 separate components. Now the main plunger, I can feel it's just broken through something, and the powder is starting to mix in with the fluid. And there's a blue line which I'm sure you can see just here, and this plunger here is supposed to go up as far as the blue line, and that's there. And then you can see that what was a clear fluid is now being mixed in with this powder. The powder is mixing with the clear fluid. And a bit like making hot chocolate. It's not mixing in as well as I'd hoped. But I'm going to go a little bit further because there's still air between the top of the fluid and the syringe. And obviously we all know that injecting air into one's body is a bad thing. It's going. There's still a bit of a clod at the bottom. Do you know, I can't even remember the nurse at the doctor's surgery doing this. Maybe it's because I've had the thing in storage for a month that it's just sort of settled more than they normally do. God, what am I doing? Okay. Right. Now the powder all seems to be held in suspension. I know some of the technical words. In the fluid. Right, that's looking nice and nice. Nice and mixed in now. Let's just make sure. Yeah. Okay. So here we go, folks. You're going to witness my first self-administered injection. I'm going to push the plunger up further and further. I can see it starting to get past the very top plunger, and I can see it now in the pale blue. Oh, there we go. Teeny weeny little droplets have just emerged from the top of the syringe. So I understand it's a matter of just going for it. 45 degrees. Oh, didn't feel a thing. Do you know what? I really didn't feel a thing. I was pinching my considerable belly quite firmly. And perhaps it was the fact that I was doing that meant that, yeah, I really didn't feel it. I can feel a little bit of the after effect now, but it's not something I'd describe as painful, not in any way, shape or form. So what do I do with the sharps? I had prepared a large laundry, soap. Oh, that's not going to work. An empty laundry soap bottle. But sadly, one of the cleaners took it away, thinking, what's he got that in his cabin for? So I no longer have that. So I'm going to go and hunt now for something to make this super safe. And in the meantime, put the cover back on the needle, because this is what seems to freak everybody out in the medical world. There we go. Right, well, a bit long and laborious perhaps, but thank you for watching the video. Leave any comments. I'm not a regular poster, but leave any comments if anybody found it useful. And I can honestly say I'm never going to be afraid of this again. I think the key is to make sure that all the white powder is mixed in with the fluid, with the clear fluid, and it becomes really milky. I think cleanliness is really important, and I think the injection itself, bang, straight in, and then pressure on the plunger all the time. And quite honestly, I don't know what I was frightened of, because I was. Anyway, good luck to all of you. Thanks for watching. Oh, a little postscript. What I've discovered is that the empty packet, even with the extra plunger screwed in, and obviously the cover replaced back on the needle, it all goes quite neatly in. So no more chasing after a large plastic container. I think that's going to be good enough, and it's going to go straight into a large trash container outside, so nobody's going to get their hands on it. Bye bye.